My name is Susanna Burt. I apologize. As I told someone this morning, I am the Prevention Program Administrator here at the Division of Substance Use and Mental Health, and I am totally a last-minute mama, and this is now done. So I was going to take some time to kind of figure out who was on the call, but what I figured I'd like to do instead is to go through this, and if you guys have any questions, because our time is really valuable to be out in the community, I didn't want to take too much time to distract, and this is important. So I appreciate everyone who's taken the time to be on this call. I appreciate Logan Reed and Southwest Behavioral Health and the Utah Prevention Coalition Association for helping us using the GoToMeeting app and recording this. So if there's someone that isn't able to be on, or you know someone that isn't able to be on, they can listen to this later. So today we're going to go over the Parents Empowered Mini Grants. This is a request for proposal. I tried to send out to everyone the white paper as well as the actual document for the request for proposal. So you had those if you wanted to reference them. We'll go over them line by line pretty much. But I also like to have something of my own to be able to mark up and change. So why are we doing this? The question is, are we just doing it because we want to promote Parents Empowered, or is it because we really want to change our community landscape? We want to make it healthier. The big thing is, do we want to increase that community-centered, evidence-based prevention in our local communities? And as a note, that may sound like a really long, fancy word, and it is, or a fancy statement, but it's very detailed. And I was on a call this morning with a bunch of researchers who threw out community-centered primary prevention, or evidence-based primary prevention is what their goal for the national and global communities that they're working with. So I think Utah is totally on the ball with this. We're doing this to engage our key stakeholders, sometimes that we're seeing some of those gaps in our communities. And we're hoping that this increases the participation in the communities and ultimately funding. So this may not get you more funding immediately, but it could start that ball rolling for you. And we'll go on to some of the research with that as well. And then better outcomes. And while we're focusing primarily on underage drinking for this one, it isn't just underage drinking, it isn't just alcohol consumption. It could be changing how much participation in all prevention your community has. That's our main goal. And it may actually improve academic performance in your high schools or junior highs. It may increase or decrease other substance use, because if we look at the prevention and we're doing community-centered evidence-based prevention, then we'll see changes. I wanted to put this very front. These are the key dates. And the key dates is that this is due Friday, January 5th at 12 noon. We will then turn around where we're going to review the applications the following week and make an award announcement that next Friday. The awards can be for up to 3 years. You do not have to apply for 3 years, but you have the ability to apply for 3 fiscal years. So as you're doing this, you may have questions. Who can help you? Well, we have our regional directors, and that would be Rob Timmerman, Alan Sane, Vern Larson, and myself, as well as your coordinators. If you're a coalition in a community, your local substance abuse authority coordinators would be great resources. They may help you write it. And then ultimately, you can ask myself or Craig Povey here at the division for any additional questions. All right, so the first thing I'm going to kind of talk about is a white paper, which is one of the documents I attached. And we're not going to go through this one line by line. We'll go through the last couple of pages a little later. But the main thing that we're talking about is, why are we doing community-centered evidence-based prevention? Is there any research that it works? Why, yes, there is. There is research that it works. There is research that it's been going on for decades, and around the nation and around the globe, they're just starting to adopt and implement it with fidelity. The research shows that from the point of finding an evidence-based practice that has adequate research behind it, it takes about 17 years for a community to actually implement it. And we wouldn't do that with cancer. If we had something that saved lives with cancer, your bet we're not going to wait 17 years to implement it into a community. We're going to try and get it out as quick as possible. So that's what this white paper is going through, is that it identifies one of the best models, which is communities that care, and that helps increase community mobilization as well as decrease substance use and negative outcomes, all the risk factors. On the second page of that, there's a little box that talks about that there were communities that use CTC were 25 to 33% less likely to have health and behavior problems than those from control communities. And just in case you didn't know, Utah was a part of that longitudinal study with the communities that care starting in 2005. And then the last couple of pages of that document is actually the tiers, and we're going to go over that. The tiers kind of show readiness or where your community starts at, and it doesn't matter where you are, everyone's eligible for something if you apply. So I want to just share with you all that if you didn't know, I really like pop culture. And I did something with my child late last night because she needed it, honestly. And we went and saw the Star Wars movie. And so it was so hard to not tie in the entire movie because there's so much that ties into this RFP that I was like, oh, this is a great example. So I tried to pull from old Star Wars. Anyway, so what we need to do is we're going to go over the
from Dana. I haven't seen it yet.
I know. That's what I fought every urge. And my other child, by the way, she's in a class that's cinema survey because she's a senior and has all her classes done, and she got to take what I consider a fluff class. But they actually got out of school. They're watching the movie right now, which I thought was a pretty cool class. So, but no spoilers. So this is all kind of related back to the previous 7 movies. Anyway, so that's the Death Star, and there's a target on the Death Star. They're targeting when they shoot the laser beam, or the whatever you want to call it. So what I need from you in the request for a proposal, this is the narrative. This is what you're going to write to and send to us. And in this, I'm going to tell you right now, on the request for proposal, we have a total of 14 different questions or responses that we need. Please write 1, name of coalition and describe target population. And then underneath that, tell us what the name of the coalition that is submitting the application and the community or the geographic area or the target population that you're going to plan on serving. List that in the paragraph underneath number 1. Then you'd go to number 2 and list the contact person, and then you'd write the contact person. This helps us as grant reviewers to make sure that you're writing to the questions, and you may feel like you're repeating yourself. That is okay. You can repeat yourself as long as it makes sense. But going back to the slide, when we start talking about our target communities, it isn't necessarily that you're going to say parents of 10 to 16-year-olds in our community. That's great, by the way. However, how are you going to mobilize that community? How are you going to reach them? Maybe it's engaging our key leaders. Maybe it's engaging our business community. And that's the target population you have for the grant. Again, the contact person is who we're going to contact to get with a letter of award or saying thank you for applying. It may be a fiscal agent, and maybe the coalition coordinator. It could be a key person or a key leader from one of your exec boards, but you just have to make sure that you know who it is and that that's the right person that the information goes to. Number 3 is our identifying community mobilization needs of this target population. Okay, you don't have to use all the consumption data. We talked it over, and what we would love to see is maybe something like a community readiness, or hey, we don't have anyone involved from our business community, and that's what we needed to list, that, you know, this is where our gap, or where we need to start from, our baseline. You may also look at risk factors. The Student Health and Risk Prevention Survey identifies a number of parental involvement factors that you could identify for your community. You also could use other data such as consumption rates. You could use arrest rates. You could use DUIs, but I would strongly discourage that. It's not as impactful when you're addressing community mobilization as well as youth use rates. So those are the things about when you're talking about the needs of your community, what assessment you're going to do. Okay, so this is 4 and 5, mainly because they kind of work together, but don't, when you respond 4 and then respond 5. Do not combine them. I just thought it makes sense on the slide. How long do you want to do the project? And you can request up to 3 years. We would renew it, make sure everything's on target. That's part of our monitoring process. But the years could be different. You may decide between now and the end of the state fiscal year, and maybe we have permission to kind of go beyond, a little bit beyond that, but you only want $5,000. That's totally fine. But for the next year, you think, gosh, we really need $15,000. That's fine. And the last year may want $10,000 just to do a great event, or really keep people involved. We say that $10,000 a year is a guideline. That's what we said, so that we figured we would make up to 10 awards with $10,000 per year. But again, we have permission to give a little bit of leeway, that if we wanted to do a little bit more in that second year, we could. They have some ability with some of the funds. They have a non-lapsing clause, so they can use some of the funds over into the next year. But we don't want to do everything in the second year, because that might be a really big burden on the budget. But we'll see. We can work with it. And the last thing with that is, please be as clear as possible. If you really don't think you'll be able to spend $10,000 in a year, there's no shame in asking for only $6,549. But if you think you can spend $10,000, explain to us how that's going to look. Is it, do you expect that you're going to put a huge amount into the event, an event with whether it's town halls, whether it's a installation in the community? You think that's where your money is going to go? Then put it there. And it may not be expensive, but tie everything back to community mobilization, underage drinking. Here's another thing. You may not, oh, sorry, yes, you have a question? Was there a question right there? Okay. You may not know what all your costs are going to be. And so an estimate, but what you think an estimate would be great. Again, be as clear as possible, and it's not going to count against you if you say, well, we anticipate these things to happen. And this is why we want to do them.
Susanna, it's Tiffany. I have a question.
Yes.
How tied to underage drinking do we need to be, particularly if we're in that tier 1 level of, just trying to sort of engage stakeholders and doing a community effort? Like, what does that look like?
So you can bill it as community mobilization and strictly community mobilization. But I would tell you, if you have anything in there that says you're going to address marijuana, we're going to have to tell you no. And sure. Here's why. This is a Parents Empowered campaign. Right. Right. So it does eventually have to, but if your focus is to really build up that community mobilization, because you're in tier 1, and for the rest of you who haven't looked at the tiers, we'll get to that in just a couple slides. Then you can say, we are at tier 1, we desperately need to involve our CEOs or our mayors or our city council or county commissioner or the sheriff. And this is what that looks like for us. And that's totally
Okay.
fine. If your measure, go with it. And we're going to talk about that again in like on slide 11 or something. But
So
yeah,
we're trying to get them engaged in community-focused prevention, not just community-focused social host ordinance, something really specific to underage drinking. Okay.
Right, if you're a tier 1. And I think that as you move forward, and we're going to talk about it in just a few more slides, so I'm going to put a little parking lot for that, but just know that, yeah, that you are correct, Tiffany. Okay.
Thank you.
Susanna.
Oh, yes.
Susanna. This is Jen.
Hi, Jen.
So hi. What can we spend the money on? Because my understanding was from many grants in the past that pretty much the $10,000 was spent on Parents Empowered collateral, or whatever that Parents Empowered came up with. So I guess I'm confused on how to set a budget.
So if you're
going to come up with the idea.
Okay, so if you're going to do community mobilization, it may be smaller events related to community or Parents Empowered. Okay. So I just asked the question, and I'm going to turn my head or try to turn and talk to you because I have it written on my whiteboard. For the budgeting, my division is responsible for balancing the budget with the grantees and telling you what has to be invoiced to R&R. Okay. There may be mass purchases for something that everyone uses, which may be a collateral item. And those of you, if I'm using jargon, it may be T-shirts, or it may be billboards, or it may be a wrap. It could be staff time from R&R to help develop any ideas or events or things that you do in your community to build that mobilization. And then there will be other expenses that you may incur that we would then have to invoice to R&R, which we would approve. If you're talking about a general, like when we get down to number 10, which is describing how you do your plan, one of the things to consider is if you're trying to only do community mobilization, what is it that your community needs? And again, you may not need a whole lot of money in one of the years, but other years where you think you're going to have a big event, you will need more money. So it would be staff time for R&R, not for your agency. It would be, or your coalition. It would be maybe a smaller event to gather them together, which not including food, but maybe a rental of a community facility, or having someone come up from R&R or the different groups to present on how Parents Empowered works. It may be something as big as what happened with the ski team, where you bring in all the different mayors and police chiefs and really working with them to have a combined campaign. Those are the types of things that we would expect. So yes, Jen, it is primarily, if you're looking at collateral, Parents Empowered, but there may be other things that you're doing that help you build on in your community.
I guess I'm still confused because, so if I say we need to engage our key leaders fully, so all of our mayors and all the police chiefs, my understanding was that we just had to identify who we were going to try to engage, and then Parents Empowered would come up with the idea. But in order to set a budget, I'd have to say, we're going to do it at this event or whatever. But I thought they didn't want to do that.
It really is that you're right, that if you want to be specific, but we don't want necessarily specifics in the sense this particular event. And I'm going to have to make you wait for a minute because I actually have a slide that goes over a little bit more of this.
Right.
But yes, you are correct, but there are other options.
Susanna?
Yes?
This is Robin. Did you say that
Robin.
it cannot cover food?
It's for discussion, and so if it's appropriate, and it would depend on the event.
Okay.
All right, so I'm going to move forward, and then we're going to have some more questions at the end. So do write these down if you forget or if you have other questions. But I wanted to really get through what we had. So current partners, we do want you to identify who you're already partnering with They may not be a part of your coalition, but how do you want to get them involved? Do you want to get them involved in your coalition, or you just want to sponsor? So looking at how involved they are in your community, and what do you want, if you're missing people, identify who you want to be a part of it. This may be a local grocery store. It may be a local business owner, and it may even be your city government if you don't have involvement or partnership with them. So a catalyst and a champion. You may not have either, or you may have both, or one or the other. We'll take it. A catalyst is someone who introduces this model to the community. So someone who has a passion for it. It may be you who has introduced a coalition to the community saying, we need a coalition. And a champion is someone who primarily like your mayors or someone who really has a lot of influence with a lot of different people in your community. Do you have one? If you do, identify who they are and their affiliations. And if you don't, how are you going to recruit one? Because we know that having at the bare minimum a champion, that's someone that can really bring the right people to the table, helps community mobilization. Again, you're going to think like this sounds like repetitive from the next couple, but it's not. There's differences. But provide us a roster of your key leader or your executive board. This may not be your entire coalition. This would be your executive group, and identify their attendance. So an example maybe is that you have on your rosters your mayor, your city council, a business owner, you're a director of an agency, the school superintendent. And of those, whatever people, only 4 of them come every month, and the other 2 vary. And you feel like you're missing legislators. That's where you're going to say, this again helps to reinforce your baseline of where you're at. Who's missing? Who do we want to have be a part of it? So strategic plans. This is one of the places or one of the things with this model this grant that we hoped you would move towards. That by the 3rd year, you would have a strategic plan if you don't have one. If you do have it, that second bullet that says when attaching, still identify it in the narrative, you don't have to merge it into the narrative, but you would say, we have developed a strategic plan, please find it attached, and attach it as a separate document or at the bottom of the application. And if you have a link to it, just put the link in the document. If you don't have one, we would expect you to look at how this model can help you get there by getting involvement, using Communities That Care, using the Community Anti-Drug Coalitions of America model, or even at the bare minimum, the Strategic Prevention Framework model, and how you would have that, when you would have that plan done or expect it to be done. If you do not have one, it will not count against you. You would still just need to explain when you feel you could have one. Okay. In case you didn't know and didn't see Rogue One, which came out a year ago, that in her hand are the plans to the Death Star. So do you have a plan? This is what Jen's talking about. Don't get lost in the creative. That's where we have time for R&R, who is our contractor, to help you with. That may be one of the billable items in your budget, which is time with R&R. What is their staff time going to look like? What is going to help you move your community? You want to have specific target groups. So maybe it's, I'll use one of our previous grant was with Wasatch County, and they worked with their Wasatch Latino business community and had a really great involvement. That was to really engage them in the conversation. So that was a specific target. Looking at your tiers of where you start at and where you hope to finish is what we're going to go over in the next few slides. Broad ideas, again, for Jen and for anyone else. It may be that you're bringing people together, and that event may be small. That may be a town hall event, or it may be having lunch and learns with certain community groups. It may be that you wanted to saturate the community with billboards. These are all things that are kind of broad, and you don't have to come up with the creative, but those are kind of ideas. Okay. Now the next 2 slides, we're going to go over the tiers. And the tiers are where you can figure out where your coalition or community is. This is intended to be a guideline to say, if you're a tier 1, you absolutely could use all 3 years of funding. But if you're a tier 4, maybe you mentor, or maybe you just use 1 year of funding and then mentor someone else. So going into tier 1, you're looking at engaging the community care strategies. So building up a community coalition, starting with phase 1, which if you're not familiar with it, it's really getting, again, those community leaders to participate and help guide you through building a plan. Hello? Okay. Did you have a question?
Okay. Okay, thank you.
Okay, someone really is on the phone. Okay, I'm not losing my mind.
Hi, Jim. Well, and you?
Hey, Kit. Okay, I was going to tell you he is not on mute. Okay, so tier 1. They work behind the scenes to activate a small group of catalysts. Like going back to that other slide, it is someone in the community that could share about the model of the coalition. You start looking at the data, looking at the readiness of the community. Are there other leaders in your community that could help speak to it? We've had judges in the past go and present to other community leaders, whether it's a city council or whether it's a mayor meeting or other judges in the community to engage them into the process. We've had sheriffs do it. We've had city council people do it. But you want to really start seeing what's available in your community, and that's where your tier 1 is. That and as Tiffany was explaining, I'm assuming she's talking about either Moab or down in Emery County, that they're starting from scratch, and that's okay. But at the end of tier 1, you're going to be able to say, here's our coalition, here's who's involved, and we have an action plan. And an action plan doesn't have to be a strategic plan. It's kind of like where you're going from this point. If it's a full-on strategic plan, even better. But this is where you're at. Tier 2, this is where a lot of communities are right now. They have a plan of some sort, and they're trying to implement strategies or programs, and they're trying to really get that buy-in from their community leaders to support those programs. Again, they have a website or a plan that has a very clear message. You meet with the leaders regularly. There's some sort of monitoring or evaluation of programming or strategies in the community. You meet regularly, meaning like monthly or bi-monthly, and you identify your needs and what the gaps are. You host a media-worthy event. So a media-worthy event might be something, again, I'll use South Ogden and Riverdale as an example. They put stuff on all of the city vehicles, and they hosted the event in the fire department and had all the different city leaders come, as well as media there that was local media. There have been larger events, again, like in Park City. But that Park City, I would say they're tier 1 or tier 2, but this was something that really shot them forward to getting people involved and engaged. And then describe a plan, following the media-worthy event and sustainability efforts. And we're going to go over sustainability again in a little bit too. But by the end, you will have a plan. You will have a strategic plan. So it's not just an action plan of this is what we want to do. It's much more detailed. You have identified partners. You have either memorandum of agreement or understanding with different partners, and you know how you're going to implement the plan. You'll have that messaging from the momentum of the press conference, and it will, again, keep moving you forward because people are going to talk about it. It's something that's exciting. Tier 3, they've started implementing the plan that they came up with in Tier 2. And they have some sustainable resources that could be funding. It could be in-kind donations. But you have different programs, policies, and strategies that are being put in place and are implemented. Policies aren't very expensive, by the way, in case you didn't know that, but it could be a lot of time. You update your plan regularly, and you use data to update it, not just gut feeling. And then you will continue to look at the success of the projects and then report out. So whether it's to, we have UPCA, or UPAC, which is the Utah Prevention Advisory Council, the division to maybe present at our fall conference, or even through the Utah Prevention Coalition Association, which is UPCA, because we love to make everyone confused. And those are the groups that you could work with and support and share with your successes. And then Tier 4 is kind of, it's been saturated. You have things going on. You really have, you've got a key leaderboard. You've got your key partners involved and engaged in participating. Your director of an agency sits on the key leaderboard or even the community board. You have events that occur that are then complemented by strategies that are throughout the year. So whether it's a policy, whether it's a direct service program, you're looking at different ordinances and different, again, one-time events that build on each other. Are there questions? I'm gonna ask this point, are there questions about the tiers? Okay. So community mobilization should be one of your outcomes. Going back to one of the first slides, it's identifying where you're at. What do you need to improve? What do you need to change? Is one of your outcomes going to be, hey, our mayor of this city has never been involved, he doesn't come to meetings, and then that would be an outcome that he comes to a meeting, or she. Are you seeing more of the business communities participate, and that they would be offering up platforms for you to to share the messages in your community? I know that Northeastern at one point was working with some of their theaters as well as some of their car dealerships. So maybe that's what you're looking for, specific partners there. Is there new funding? When you look at communities that have a strategic plan, again, have a solid strategic plan that have objectives that they want to reach, that's what gets other people, whether it's private or other grants, to fund them. So that would be an outcome. So perhaps you say you're going to write for a particular grant, or you're going to seek out other funding. It does not have to be just funding as an outcome. The timeline. So the timeline is kind of how you're going through over the next 3 years, what you're going to do. So there's activities and milestones that you might mark. It may be building a key leaderboard, engaging a key leader. It could be the town hall events or a media event or an installation that you're putting in for the Parents Empowered. It could be the assessment that you write, that this is what we're going to look at. And it could be training that you're going to send people to a Parents Empowered group meeting. But that's what your timeline, what you're going to have everyone to understand what's going on. And it is for all years of funding. Again, you'd go from January 2018 until, till June 2020. Yeah, 2020, I think it is that one. Yeah, 2020. And again, there can be some bleed over. So if you put it till September of 2020, that's fine. So sustainability plan. So it isn't just about the funding. It's how you're going to keep, if you have this event. So I'm going to again use Park City as an example. You had this really amazing event that had the mayor there from Park City, you had the ski team, you had the chief of police, you had legislators, all these different attorney generals there for the city, all there. And how are we going to capitalize on that from that point forward? Is it going to be that, hey, we'll see you in a year? Or is it, we're going to make sure that there's someone, that there's a coalition coordinator that's going to reach out and engage with this person, or our champion is going to really make sure that the mayor keeps coming or at least is informed? How are you going to keep them engaged? Are there policies that you might think about to sustain the activities in your community? Those are the different types of things. So it can include funding, but it doesn't have to include funding. And are you tier 4? So if you're a tier 4, or you will be by the end of year 2, is there a coalition or community you want to mentor? Put that in the last one. That's number 14. If you are not a tier 4, you can still say, hey, by the end of the grant, we'd love to start mentoring another community. You could also say, you don't know that you have the capacity, but really think about what you think will be changing between now and 2020. All right. Now, Jen, did I not answer your question? Anyone else?
Susanna, I'm sorry.
Okay, no,
You
good.
did. I guess I'm still confused. I guess maybe I just need to start writing it, and then if I don't have my answers. I'm just so confused on how to write a budget if I don't know what the idea is. I just know who we want to engage.
Okay, well, I'll start with that. And then again, like I said, the first year may not be very expensive if you're looking to just engage people. And that's okay. You don't have to ask for $10,000, and it's all right. But there may still be a smaller events that you want to do, a smaller town hall versus a big media event that you want to write for. And that town hall event might be what catapults them and their involvement and go, this is really cool, or I'm really interested in this. Or, oh my gosh, what did they just say? I have to make sure that I'm involved because that's not correct. Those kinds of things. So
Susanna, this is Tiffany. I have kind of a piggyback question on that for budgeting. Like, what if we work with R&R and they say, you know, we think it'd be really awesome if during Jeep Week we handed out all these like car repair kits. Well, I have no idea how much car repair kits cost. I have no idea how much it's going to cost for them to have them labeled. Like, I think that's to the extent of if I don't know what their artistic ideas are at the table, how do I know what kind of dollars to assign to that?
Make your best guess. And if it goes over, we'll figure it out. And that's honest truth. Because I'm going to be honest, you guys. How many of you guys have heard or seen anything that was done with the Intermountain Medical Center in Murray? If you think about that, they were originally a Parents Empowered mini grant of what would have been $10,000. They spent close to $35,000 on that installation. But because it was incredibly media worthy and it got a lot of, it really catapulted that community into more support. It also was a platform for this is where a lot of you may have seen other installations in your hospitals that are Parents Empowered. So if it's something that really is exciting and goes, we could see a lot of application outside of just Moab, then they'll go with it and we'll see what we can, and, you know, there's enough wiggle room that we can do this. But don't let that hold you back. So, but again, if you think you're going to try and reach, 50 people, yeah, you probably don't want to say I'm going to put $10,000 into 50 people because that might be a bit expensive. But if you say you're going to reach everyone that comes down for Jeep Week, that might be an option. And that might be a really good idea to throw out there that, hey, we definitely want to use $10,000. This is an idea. Then we go with it. I know I'm driving all of you gold personalities crazy right now. Yes.
So just clarifying, so it doesn't have to be Parents Empowered specific, but it should target risk and protective factors that could also impact underage drinking. So any kind of community mobilization, growth of partnerships, that kind of thing.
Is that Elena?
Yes.
Sorry.
Yes.
Yes and no. So your outcomes can be risk and protective factors, yes. If you're looking at events, you'll still want to use the ideas that you'll use Parents Empowered as kind of the backbone of that, but it will still address other activities. Other risk factors. So you're looking at protective factors, or you're looking at risk factors for parental involvement or attitudes favorable towards, alcohol and other drugs.
Okay. Thank you.
That was a good question. Thank you.
Dana,
So that's mine. Yes.
is it possible to get a copy of these slides so that we can look at them while we're writing?
Yes. And I know I asked Logan, he's recording this, so it's available. I can send it out to the list that I sent out a reminder this morning. If you need to share it with other people, that's totally fine. And you should have the attachments that I sent the last email this morning as well. But yeah.
And then Leanne has a question asking if these are state dollars.
Yes, Leanne, these are state dollars. So for those of you who are looking for matching funds, we have a formula that we use, and we can give that to you. And these would also, again, be state dollars. These are not federal funding. This is all from our tax dollars that we come back from Parents Empowered, or the underage drinking work group, sorry, not Parents Empowered. If you have questions, if you have comments, if you want to just say, this is ridiculous, feel free to email me. Yeah, so I'm available. I am not going away for the holidays. I'm only taking one day off. And so if you need anything between now and then, let me know. I would, again, strongly encourage you to work with your local substance abuse authority coordinators if you are a community coordinator or a coalition coordinator, pardon me. And I would also encourage you to work with the regional directors. If you don't know who they are, contact your local substance abuse authority area, and they can connect you with that person. Again, they are Rob Timmerman, and that would be more of the central belt, we call it, so Summit, Tooele, Salt Lake. And then you have Southern Utah, which is Alan Sane, so he does Four Corners, San Juan, and Southwest. And Central Utah, Davis County, and Weber, Morgan, and Bear River. That's all Fern Larson, and I'm over Wasatch County and Northeastern. And if you want to know, I have time scheduled with both my areas in the next few weeks to hopefully go over this and help them. So if there's any other questions. Yes,
I have another
Jen.
question, sorry.
Don't apologize for asking questions, because if you are asking questions, somebody probably else has that same question. So, yes.
Can you just clarify again? So the first year of money needs to be spent by when?
Okay, so it starts January. Whenever we make the award, we'll start moving towards the implementation of what the plan was. But the idea is to spend it within the state fiscal year, which is June 30th. If you feel like, so I'm going to use an example of a state fair or a rodeo. So in Weber County, our county fair is usually the first or second weekend in August. If you were wanting to do something during that time, you could on the first year funding. As long as you just say, hey, we're going to bleed over a little bit because we know we're going to lead up to this event at this time. We don't want to get too far into the second year. So we've kind of said September. If you have some events that lead through the summer and going into September, that's fine. But then the second year starts July 1 and goes to June 30th of 2019.
Okay. Thank you.
You're welcome.
Sorry, I was writing down. You said second year starts July 1?
Yeah, second year starts July 1, 2018 and ends June 30th, 2019. But again, I know this sounds confusing. And again, I know those of you who are very gold personalities, you're probably going, just give me something specific. Again, there's that little bit of bleed over, like call it a grace period, call it whatever you want to call it. But again, if you have something in July, August, September, we're good. All right, are there any other questions? Okay, so if you really need me, don't hesitate, especially email because it pops up on my phone a lot easier. I may not be at my desk if you call, but that will give you my cell phone number if you needed it. Please reach out, and it's going to be really chaotic because I'll let you know we're also applying for other federal funds at the same time because, you know, holidays aren't busy enough. So let us know what we can do to help you. We really want this to be successful and we really want to work with you. So to Tiffany and everyone else on the call, really do reach out to your regional directors if you have some struggles still in trying to figure out what you really want it to say or that you don't know if it's going to say what you want it to say. Reach out to us. You know, there's a large enough number of us on the review board that you could ask one of us and get some feedback. You know, Rob's available, I'm available, Craig is available. Just shoot us an email, say, what do you think of these? And we'll move forward from there. I'm excited, you guys. I hope you guys are excited, not thinking anything too negative towards me. So I think that's it. Is there anything else?
I have one question.
Yes.
Can you hear me?
This is Leanne.
Yeah,
Hey.
this is. So we're writing the grant, and if we decide we want to write it for 3 years, are we writing just what our anticipation is for the first year for this first funding, or are we writing a plan to spend the money the first year and then we'll submit to you in year 2 what we're going to do? Or
That's a great question. No, you're writing, if you hope to apply for all 3 years, that's where the timeline comes into play, that yes, you want to show what you're going to do, estimating, an event or a newsworthy event by the year 2 or year 3. And yeah, you write to all 3 years, and it could be an estimate. It does not have to be concrete, but this is what you estimate using or wanting to use for all 3 years. So is that what you were asking, Leanne?
Yeah, I didn't know if we did that all at once on this timeline or whether it's something to submit afterwards, by year.
So do it for the timeline right now that we're looking for is for the time period you're requesting. So if you're only requesting 1 year of funding, then you would only do 1 year on your timeline. But if you were going to request all 3 years, then yeah, we would expect it to go through at the latest September 2020.
Got it. Thanks.
Welcome. That was a great question. So, all right. Again, if you need me, reach out. And I don't think that there's anything else that I have. So good luck. Have a great holiday coming up. And then, be lots of fun.
Thank you.
Thanks.
Thank you. Bye.